Hello, I'm Lee Bewley. I'm the program director of our University of Louisville Master of Science Health Administration program. I will be conducting this information session. There's a few folks that have already logged on. This session is being recorded, so if folks are not able to attend the information session, they'll be able to go back and review this presentation. The spirit of the Louisville Cardinal is pretty high. We have a really good basketball team that went out on the national stage and took care of some business here in the Kentucky area, but we have a good collegial spirit with those folks to win. We want to do the same thing in our health administration program, is to develop leaders that can go out there and win for their communities and to serve the people. And so this information session, we address a lot of questions that we normally receive in admissions inquiries. I go over some of the highlights of the program. And then I want to open up the floor for any questions that you may have about our program in terms of admissions processes, how the courses are conducted, some of the focus areas, anything about our faculty, some of our extramural activities, case study competitions, or scholarship opportunities, and then the career of a health administrator. I'm happy to answer all those questions now or in the future. Again, my name is Lee Bewley. I am the MSHA program director, and I have my contact information, lee.bewley@louisville.edu. So without further ado, I am going to pull up our presentation slide set, go through some key points of our program, and then be able to open up the floor for questions. All right. Can someone confirm that you see the slide set?
Yes.
Okay. Thank you. I appreciate it. All right. Our program is we're going to go over highlights. We have fall starts, fall of 2026 are the next starts. So noted, I'm the program director. I'm also the regent for the Kentucky chapter of the American College of Healthcare Executives. It's a professional organization that's nationally organized to serve healthcare leaders across the country, across all industries of healthcare, hospitals, health systems, group practices, medical logistics, health insurance. And my current role is I represent the healthcare leaders and members of the American College of Healthcare Executives here in the state of Kentucky. All right. Oop. My slides. There we go. So why healthcare management in the national view, and what is our work? Nearly 1/5 of our economy is dedicated here in the United States to healthcare expenditures. This is the delivery of care, health insurance, medical devices, medical equipment. And so when we think through all of those substantial trillions of resources that we dedicate to healthcare, and of course all of the other aspects of our economy are at least directly or indirectly related to healthy people or folks that are able to participate in the economy, a couple of things become evident. Compared to other advanced first world countries, it seems as though our colleagues in other countries have comparatively better outcomes. And so is there a way, quite frankly, indirectly, to take the substantial resources that we dedicate as a society within our health organizations and to be able to more effectively and efficiently utilize those resources? And so great news. That's the work of a health administrator or healthcare manager, is to take the resources that are available within your organization or system and use them to their most efficient and effective effect in order to be able to serve people and communities. So from a practical perspective, Bureau of Labor Statistics notes that the median healthcare manager salary in America is currently about $118,000. That's not necessarily the first job you would have immediately out of a master's degree program. But for those folks that are on a median basis, $118,000 is fairly substantial and meaningfully higher than the median income for families in our country. And the growth rate of healthcare managers, which goes to this point, there's plenty of work to do in our system to more effectively and efficiently utilize resources and to lead. Healthcare is growing. These positions are growing at a rate of 29% nationally. So a couple of perspectives. What does the future healthcare leader, health organizational leader need to focus? One is population health management, and not just coming out of the pandemic, in which is a meaningful healthcare intervention impacted us all, but the idea that, just look no further than our current debate on our national budget and the pressing concerns of people to be able to have access to healthcare financing matched against health organizations that judge that they don't have sufficient resources to be able to meet their missions, is that we need to find a way to manage the health of populations. That's either the whole country, our state, our region, or even our community. What are the actions we can take as healthcare leaders, healthcare managers, to be able to manage the health of our population, to provide the appropriate care at the appropriate time in a way that is health promoting, but yet, it counts for things that are out of our control, accidents, disease states, genetic impacts. We also have to be able to take those financial resources that move away from a traditional fee-for-service where care is provided and payment is given, to a perspective that there is a pooling of resources, or there's risk, financial risk shared between the payers and the providers, or even taking into consideration the consumer in terms of how they engage insurance or high deductible plans, or to be able to find incentives, for all of the individuals that are the payers, the providers, and the patient citizens themselves, to be able to take those resources and be able to provide healthcare coverage more effectively. We'll do this, of course, incorporating information systems and data, analytic thinking, leveraging emerging technologies and artificial intelligence. And then the bottom line, of course, is that we're in the people business. We work with people to serve people in communities, and we aim to provide leadership. There are usually three responses that people can have to leadership. One is they can be simply compliant. Okay, fine, I'll do it. One way or the other, I'm sort of indifferent. And the other two options, one is to be resistant, to do something contrary to what leadership is providing as the way forward. But then what all good, great leaders aim to do is to develop commitment. And that commitment is earned through competent application, but also paving a way forward that makes sense and that leads people to a better outcome. And that's what we aim to develop in our program, is leadership to be able to leverage these competencies to a more efficient and effective utilization of resources. What are the different roles that you might have as a health manager? I'm not going to go through them in general, but in management, we plan, organize, lead, and control in healthcare organization. And controlling means that we have compliance. We follow the law, we follow policy, we follow our budget, and we can work across a number of different health organizations. Wherever there is healthcare or health related activities, budget, and people, you will find health administrators that are managing the processes. The different roles, range anywhere from the C-suite level at the highest levels to the executive and operational level. And we have students and by extension alumni filling each of these roles across health organizations. And the competencies that you would develop in this program and then extend in practice and continuing education development will allow you to be able to effectively perform in these roles through your career. Why Kentucky? Why Louisville and healthcare? We operate right in the nexus of a national and regional epicenter of healthcare. We have major health systems here in the Louisville metropolitan area. We have an academic health system, a number of private healthcare and health insurance and health technology and innovation. Long-term care health is provided and coordinated here in our area, which provides us a basis for a learning lab. We have access for guest speakers. A number of our faculty are board certified healthcare executives or experienced healthcare executives with doctoral training that serve as faculty for our program in this learning lab. It also provides a basis for those folks that are working in our region to be able to advance their careers, or if you want to come to Louisville and work in a healthcare system, this is a great place to live, but also to be able to serve and have a successful career. We continue to add to this list. It's not 100%, but at the margins, these are some of the placements that we've had of our graduates over the past few years, and we're looking to, of course, to continue to grow where our students have opportunities to lead and to be able to make a difference for people in their communities. Get back to this building leaders. Look, no one comes into our program a blank slate. You come with skills, knowledge, and abilities and experiences. And so we aim to build upon that foundation. We do so in a way that our faculty and our staff model honor, integrity, and professionalism. We judge that those are the ideals that are more likely to be appealing. That when I said earlier that there's three responses that people can have to leadership, individually or collectively, there's resistance, there's compliance, and there's commitment. My experience and what the literature and my colleagues hold is that if folks hold themselves out, and they act honorably, they work with integrity, and they demonstrate professionalism in a positively oriented way, you're more likely to earn commitment, from your team, for each other. And so these competencies that you build within each of our courses and across the program will allow you to be able to assume roles of leadership and management, to take authority and responsibility and use them, appropriately to serve people and extend healthcare outcomes, to promote health and to meet organizational missions. Just a little bit about our school. Our school is accredited by the Council of Accreditation of Public Health, the CAHME accrediting body, and our program is accredited by the Commission on Healthcare Management Education. Among those programs, the 158 or so that are accredited across the United States and Canada, our program is ranked number 46. We have a very distinguished group of colleagues that are ranked with us. We're not satisfied. We're always aiming to move up in the rankings. And it's our students and their success that I think, and it will lead us there. We have a number of distinguished faculty. We have folks that participate in the accreditation process, and they work through research and practice excellence. And so students that graduate from our program bear the benefit of CAHME accreditation, pursuing administrative fellowships, or to work for employers that seek graduates of CEF and or CAHME accredited programs. And our program will continue to meet those accreditation standards of quality healthcare management education, but also nested within a perspective of public health, and to ensure that we have increasingly, healthier and more public health promoting communities and organizations. How about our curriculum? So our program is currently 43 credit hours to complete a CAHME accredited MSHA. We have 8-week terms. The 8-week terms provide a basis for working professionals to focus on 1 or 2 or sometimes 3 courses to move towards graduation. Now, I note that our current version of the online program has no practicum. We have a curriculum action working that will allow students that have no healthcare experience. And so generally speaking, if an individual has healthcare experience or healthcare organizational experience, they are not required to have a practicum. But for those individuals that are new to healthcare or making the transition, we still have the standard 43 credit hours, but for students would be allowed to enter our program and complete a practicum. And the practicum experience can be completed either through internship, or if a student begins working at a healthcare organization, that healthcare organization can serve as a basis to complete the practicum experience. So our students matriculate in the fall of each semester. We have eight weeks, fall 1 and fall 2. And then, of course, the corresponding spring 1 and spring 2. The 2 8-week fall semesters and the 2 8-week spring semesters effectively make up what the university would consider the full fall or the full spring. And then in the summer, we have a 8-week spring term. The fall 1 and fall 2 terms are back-to-back. We set up the courses so that each week begins on a Monday and ends on a Sunday. And so for fall 1 and fall 2, spring 1 and spring 2, and week 8, Sunday of fall 1 and spring 1 respectively, you'll complete your coursework, and then the next day you'll begin day 1 of fall 2 and spring 2 respectively. There are breaks within our MSHA program between the fall 2 and spring 1, which is generally most of December. Usually the fall 2 ends the first couple of days of December. And so students would have from that first week of December all the way to the first week of January where they would be in break. There is no coursework during the traditional holiday schedule, which encompasses about the first week of December to the first week of January. Between spring 2, which this saying around here in Kentucky is done by Derby. So done by the first Saturday of May, which is when the Kentucky Derby is held. Spring 2 ends that first week of May, and then the rest of May, students would have no classes. And then during the month of June and July, the summer 8-week is conducted, June and July. At the end of July, you'll finish the summer term. And then from basically the first week of August until about the third week of August, there's another break and then courses resume. So just to restate, 43 credit hours. If a student has no healthcare experience, they can be admitted into the program and complete a 3-credit practicum experience. We have 8-week terms for working professionals. Students may enroll in 0, 1, 2, or as many as 3 courses in an 8-week term. And this is the schedule we follow. Generally speaking, our online MSHA students complete the program in a 2-year period. There is a way to be able to complete courses on an expedited basis with permission from the Dean of the School of Public Health and the Dean of the Graduate School to be in an overload status. And in that case, a student may be able to complete the program in as little as a year and a half. Students can have up to 5 years to complete the master's degree program following normal university processes. So we work with each student to create a pathway that meets your life career goals, but also is cognizant that you have working responsibilities, you have family responsibilities, and in some cases you may want to match your enrollments to your availability of scholarships or your employer-based resources. You know, some of our military service members, they may be on deployment, or they may take a semester where they're going to be away and then returning. So for each student, you work with an academic advisor, myself or one of the other full-time faculty, and we map out a plan for you to complete your degree program in a way that suits you best. All right, we also offer certificate programs. So the healthcare management, the healthcare financial management, the healthcare quality and project management courses or certificates are all drawn from our MSHA program. And so why might a student consider a certificate program? A couple of reasons. One is that it could be that you want to take a certificate before you pursue the full MSHA. And in this case, any credits that you earn in a certificate program, earning a grade of A or B, can be applied immediately and directly to the full MSHA degree, but the MSHA degree and each of the certificates require separate admissions processes. The other consideration is that some folks pursue a healthcare management certificate either because they have a specific role or responsibility that they have taken. You know, for instance, somebody could be working in healthcare as a nurse, and they've suddenly been put in a role where they have financial management, or they're working with health insurance, and so they may want that specific and focused development in financial management, or similarly quality or project management. There's also some folks that already have a master's degree, but they're coming back for continuing education development, you know, to add a certificate on top of the master's. But at any rate, all of the certificate courses are co-enrolled with our MSHA students. Any student that is an MSHA graduate certificate student that completes courses and earns an A or B can apply those courses to the full degree program. Let me say another one extended point on certificates. There's no sense, you know, in terms of practicality, it's better to complete the full degree rather than taking a series of taking all 3 of those healthcare management certificates. And so we can work through strategies. If you have a question of should you enroll or apply for the full degree program or one or more of those certificate programs, we want to make sure that, and you can have extended questions. We have the Q&A session. I'm happy to address those elements. But our idea is that if a student ultimately wants to earn the Master's in Science and Health Administration, you don't really need the certificates because all of that coursework is embedded in terms of your competency development. But it could be that you want to try the certificate first and decide, is this the kind of discipline that I want? Completely understandable. So I don't mean to talk in too many different ways around this. We want to give choices to prospective students in terms of what development they want and need now, and how they might project how that development and that credential, the certificate or the degree, fits in their life and career goals. And we're happy to, you know, have those discussions and plan out the way forward. Okay, a few program highlights. So we're getting close to Q&A. Is that we work very close with the American College of Healthcare Executives. It's a professional organization that is dedicated to the advancement of healthcare in America, but specifically to developing healthcare leaders through continuing education development, through networking, and also through board certification. To be a board certified healthcare executive, a member must have appropriate academic credentials, have experience, and then be able to pass a board certifying exam that, quite frankly, a student that completes a CAHME accredited Master's in Science and Health Administration program is perfectly suited to pursue that board certification exam, because the American College of Healthcare Executives inform our competency model through the National Center for Healthcare Leadership Competency Model. So the very content that ACHE uses in the Board of Governors exam is embedded within our curriculum. We have a number of our students, I mentioned extramural activities, case study competitions, and graduate essay contests. Just 2 weeks ago, we had a team that were national semifinalists for the Penn State Case Study Competition. We had another team that competed at the National Association of Health Service Executives Conference and Case Study Competition. And we currently have a team of students that are participating in the UCLA Case Study Competition. That's in process, so we don't know final results. A few years ago, the UCLA Case Study Competition team made national finalists. We've had students that have placed at the semifinalist and finalist levels on a number of case study competitions. And then we had one of our students, Rachel Peril, won the National American College of Healthcare Executives Stoll graduate essay contest a few years ago. And so why these things, these case study competitions, these essay competitions? It does a couple of things. One is that it gives you a chance to practice as a graduate student. You work in a team, or in the case of the essay contest, is a single person event. But you give a chance to compete, to practice. And the people who judge these case study competitions and also judge the case are practitioners, future potential future employers or your bosses. There's an opportunity to get feedback. And then, of course, a couple of brass tacks considerations is that students that reach the finals or they win one of these case study competitions, there are funding opportunities. The students that finish first, second, third, sometimes fourth and fifth, they receive hardware. You have something suitable to put on your mantle, of course, put it on your CV or resume. But there's also scholarship dollars that the team members earn that could be as much as $5,000 or at least $500 to $1,000 for each student. And then one extended point is that our program supports the case study competitions. If there's any travel or registration expenses that are associated with the case study competition, for instance, the National Association of Health Service Executives competition was in Pittsburgh, Pennsylvania. We took 3 students. We covered their hotel rooms, their flights to Pittsburgh, and per diem, and then the registration for the conference and the competition. We do this for our program development to advance our students. It also gives us an opportunity to see how our students perform as part of our program evaluation. And so these opportunities are available to students throughout the period of the program. And so we can go into more detail, but there are a number of good reasons. And we like to, just like our Louisville Cardinals played last night in the Yum Center, we like for our MSHA Cardinals to compete, when there's opportunities to see how they stack up against their colleagues from other programs, but also see, having some affirmation of your development to the extent that you have the time and opportunity. All right. I noted administrative fellowships. There are a number of national administrative fellowships, and some of you might say, what is an administrative fellowship? Well, it's a postgraduate developmental opportunity. So after graduating from the MSHA program, there are next step developmental opportunities. And so these next step development opportunities is for a 1 or 2 year period. An administrative fellow who is generally just graduated from a master's degree program, or it could be within 1 or 2 years, that either just or recently graduated from a program. For 1 or 2 years, you are assigned a preceptor. You're a full-time employee at a major hospital or health system. And a preceptor will guide you through a series of projects, rounding activities that are intended to do 2 things. 1, build upon the development that you've recently completed in your master's degree program, but to prepare you for a utilization assignment following the fellowship with that health organization or health system. And so all across the country, here in the Louisville metropolitan area, in our region, there are a number of hospitals and health systems and health organizations. The federal government also has administrative fellowship opportunities. Is that graduates compete. There is an application process. There is a National Administrative Fellow Consolidated Application Service, NAVCAS, in which you can submit your resume and your references, and you can apply to multiple fellowships across the country. The pay for an administrative fellow varies. It's different in Los Angeles than it might be in Owensboro, Kentucky. But generally speaking, the pay is somewhere in the neighborhood of about $70,000 to $100,000. And then upon completion of the administrative fellowship, 90+% of the time, the health system will offer that person a continued permanent employment in a director or an appropriate leadership or management role. And so we can go into more detail, but the key point is that our program is CAHME accredited, and there are about 250 administrative fellowships across the country that will only take applications from CAHME accredited program graduates. All right, our faculty, myself included, are doctorally educated. We are, in many cases, I am board certified as a healthcare executive with experience as a healthcare leader. A number of our full-time and our adjunct faculty have a great deal of experience. We have a couple of executive and residents. One is the former chief medical officer of one of the major health systems here in the Louisville area. And we also have one of the population health directors of Kentucky One Health here in the Louisville area that are on our faculty and serve as advisors to our students. We are very active in the accrediting body, CAHME, and then the Association of University Programs of Health Administration, which provides scholarships and developmental opportunities to students. 8-week focused courses. And we have flexibility. We say you can either tap on the gas or mash on the brakes, depending on what your life and your work balance is for those 8-week terms. The normal way of enrollments is that just before the beginning of the semester, the fall or the spring or the summer, you will meet with your academic advisor, who is a faculty member. I have about 25 or 30 students that I serve as the academic advisor. We meet, we catch up what's going on at work, what's going on in your life. Okay, let's look out to the fall. Let's look out to the spring. What does your schedule look like? Are you aiming to take 1 or 2 or 3 courses? Or do you need that maybe you take 2 courses in fall 1, but you have a deployment, or you're going to have a child, or you're going to be traveling and you can't take any classes in fall 2? Okay, we'll put that in the plan. We work through and tailor an enrollment plan that matches your life and career reality. Again, the university provides up to 5 years. I think there's actually a 6 by exception, but you have 5 years to complete your degree. We don't want you to have to take 5 years, but that flexibility provides a basis to tailor a degree completion plan that fits your reality. One quick point, and I'm going to move to point of contacts and Q&A, is that we're updating. We're continuing to improve and enhance our curriculum. Our program is CAHME accredited. We have met all of the requirements. We have a great curriculum, but we're not satisfied to stand still. And so our faculty are looking ahead to next fall, and we're incorporating elements of how to use artificial intelligence in the practice of healthcare management and leadership through information systems, some familiarization. Of course, we want our people in our program, in our folks that we serve, to be able to have in-depth analysis to make better and more informed decisions to get those efficient and effective outcomes. And we continue to focus on population health. The population health perspective, takes into consideration that we need to serve the people. We need to be able to take the resources that we have and use them to their greatest effect, because there is still a substantial need. And most of our students work in organizations that have missions that are dedicated to enhancing the level of health in their communities and in their population. And we want to make sure that they're prepared to be able to meet those requirements in the workplace. All right, here's some key contacts. I'm the program director, Lee.Bewley at Louisville.edu. Our director of student recruitment is Deepti Jain, and our admissions counselor is Jennifer McLean. The deadline, I noted earlier that all of our students matriculate in the fall semester in August. If any student or prospective student that has a working application started before July 1st, we will consider them for matriculation. But here's the thing. We process admissions actions as they come. So if you apply today or tomorrow or sometime in the next few weeks, as soon as we have your full packet together, we organize a admissions committee interview. And so what are we looking for in that admissions committee interview? We'll set up a Microsoft Teams meeting. Is that if you meet the GPA requirements, you have the letters of recommendation, you send your resume, we're wanting to make sure that there's appropriate fit. We want to make sure that what you're looking for in your career development, your life development, and a master's in science and health administration program fits. And then we also give you a chance in the interview to ask us questions to make sure that we fit right with you. The worst thing that can happen, and it's a waste, is that someone would start a program and only take a semester, like, this is not for me. We have a very high degree completion percentage. I think it's a large part in that before a student even starts the program and in the admissions process is that we have folks that they thoroughly understand what they're getting into, they have a clear view of the requirements, and they have a commitment to completing the program. And so we have a very good completion rate in our program, and we want to do that and not waste anyone's time, provide a quality education, and get folks to alumni status to extend their careers and succeed and thrive and continue to serve people with great leadership. I also have a QR form. I think you can use your phone, and you can be able to go to get a form that we can follow up and provide additional information as appropriate. Okay, that closes my slide set. I'll open the floor to any questions. You can either open your microphone or raise your hand or type the question in the chat box. I'm happy to answer any questions that you have. Don't see any. But look, I'm going to say this, and just to fill a little bit of time, if you're considering a question, I appreciate your interest in our program. We aim to provide a quality educational experience. Our students, do well. We have students that place in administrative fellowships each year. We have a number of students that are from the military sector that either seek commission or that they are looking, of course, for promotion or moving to the Medical Service Corps or one of the military medical service branches. And then we have folks that are in the Louisville metropolitan area that simply are looking to move onward and upward in their organization, of course, across the country. If there is an opportunity to be able to meet folks where they are and to improve their opportunities for advancement in their career, we aim to do that. Whether or not it's during the program itself and up to graduation or after graduation, using our Rolodexes. Do we still have Rolodexes? I guess it's our LinkedIn connections to be able to match alumni, to be able to connect people in our communities, in our networks, to be able to have opportunities. And to that point, as an example, the American College of Healthcare Executives, and we encourage student membership in that organization as well as others, is we have an annual meeting. This year it's going to be in Houston, is that we have a current student, faculty, and alumni meeting among the programs, the program there in Houston. And we often provide opportunities to have students and alumni from across years be able to get together and meet, and it provides a great opportunity to extend that cardinal network. All right, guys, I'm a professor, and I'm always happy to talk about our program and the way forward, but I just want to give you guys one last shot. Any questions or anything I can do to help?
Yes, can you hear me?
Michael, yes, sir.
Yes, sir. Okay. I just want to make sure. So, yeah, I'm still active duty. I got about 17 months until I retire, and then I just got my undergrad at healthcare administration from Liberty University with a 3.2 GPA.
Outstanding.
So I've been doing a lot of research trying to figure out like which program to utilize, with the military, still being active duty versus like when I retire in about a year and a half or so. So if I being active duty now, when it comes to the like tuition assistance,
Michael, I think as an active duty, I think you have a $250 rate.
Correct. Okay, well, I just wanted to verify to
Yes,
make
sir.
sure. Well, being I think it's a master's program. I think it bumps up to 350 if I'm not mistaken. I think if I'm not mistaken, right? I think that's what it is.
I'm tracking
I think,
250 for,
okay.
I guess I should, but I'm retired Army. I'm an Army Medical
Okay.
Service Corps officer. I think it's
Okay.
250. When I say tracking, that's just the way we talk. I
Oh,
think it's
no worries.
250, unless you, I don't think that U of L has changed it. I
I
could
just
double
always thought
check,
it was 250 for undergrad, 350 for masters. I could have been for a TA, tuition
but still a
assistant.
pretty
So
good deal either way. But
yeah,
I think it's
right.
250.
Okay, I'll double check just to
The
verify
only
because
thing that might
I
differentiate Michael or anyone else is that I don't know if it's different if you use the GI Bill, if there's a tuition rate associated with that, as opposed to um, like in the Army, we had our guys would go to the educational office, and there was a contract set up between the educational office and the
yeah.
institution that has that special rate. But at any rate, there's definitely a discount for one well earned for our military service members and our veterans.
Okay, perfect. And then the other thing was when it comes to if I applied, like say tomorrow again, and we talked about doing a an interview. When it comes to resume, so I haven't been to like the transitioning class yet. Obviously, when it comes to doing the, like trying to
Like
translate what I've done,
for the interview,
versus.
Michael,
Mhm.
it's more about your goals and aspirations.
Okay.
You don't have to show that you come with experience and coordinating group practice, appointment scheduling template. It's
Yeah.
it's more like, what are your goals? What do
Exactly.
you
Okay.
seek in your career? That's the fit part. Is that
Okay.
if you have the academic preparation for you or for anybody on the call here, our minimum GPA is 3.0. There are, by exception, a student could be admitted to the program but with a 2.5 to a 2.99. And I say this, if you have a 2.5 to 2.99, the university processes is that we can allow admission on a conditional basis. And what the conditional basis would be is that you would have to earn at least a 3.0 in your first 9 hours of enrollments in the graduate program. If you have the 3.0 or higher, and 3.0 is what is required to get the degree, then the conditional admissions is completely considered. You're good to go. On the other hand, if somebody were to come into our program on a conditional basis and they don't own the 3.0, then the offer, but 3.0 or higher, you meet the qualifications. Then there's the experience, there's the letters of recommendation. And really that interview is just, we're assessing, and I sit every interview, and this is where it's on a binary level, yes or no. Does this person have a good idea of how they can use this degree, how they can use this development in their life and career goals? And if the answer is yes, if they have the 3.0, if they have the experience, and they have the letters of recommendation, you're good to go. We have a spot for you in our program.
Okay. Perfect.
Where we
Thank you. And
say
then
no, and I can't help it, guys. I'm the kind of guy that if you ask me what time it is, I'll tell you how to build a clock. The times that we say no to a student that applies, things happen. Like they don't show up for the interview, um, which reflects unprofessionalism if you don't coordinate. If someone had a really bad GPA, like a 2.1 or 2.2, and we judge that there's not a likelihood that they would be able to successfully complete the coursework, or if someone interviewed and they're not sure what they want to do, like I hear that healthcare is a big thing. I'd like to get into it. Like, well, are you prepared to take leadership or management roles? Do you want to be responsible for a budget? I don't know about all that. What I'm getting around to is if someone either had if their academic performance indicated that they might have a great deal of stress in a graduate program, if they were unprofessional, like didn't show up for the interview or did something that didn't seem like they would be a good member of our community. Or the third option is that they don't have a clear view of how you'd use the degree. Michael, you asked the question. I'm answering really for everybody.
yeah.
Is that those are the reasons that we say no to our program. But we want to say yes. We want to grow our MSHA community. We want to serve students. And so if you have the preparation, you have a clear view of the way forward, and you seem like you be a great fit in our group of colleagues that are learning and growing, we've got a spot for you.
Okay, perfect. And then there was one question I had, if you don't mind answering. It might be personal a little bit. It's just um, CAHME accredited versus just getting a healthcare administration degree
I'm
that's
tracking.
not CAHME accredited. I know obviously you're fashion you're accredited and all that stuff. I just what in your experience with people who have that degree with CAHME accreditation and not, what would you say to somebody who's trying to go
So let me say
one or the
this.
other?
There's two different types of programs that are not CAHME accredited. And look, I would say this, if I had a colleague from each of these two schools, there are some health administration or management programs that are not CAHME accredited that, like, it could be Harvard or Yale or some school that just at face value, they're like, we're Harvard.
Yeah.
Enough said. Or there's other programs that they probably couldn't meet the criteria if they were to go for it.
Exactly. Yeah.
And when I say that, it's not that it's a bad program, it's just that they don't strive to meet all of the standards. Like there are elements of the CAHME accreditation criteria, like having a clearly defined competency model, that our students will meet these competency model goals. And then the other element of it is part of that connected to that is that after graduation, they will be placed in roles, they'll have jobs that are aligned with what they came here for. And so just in that example right there, if you're the type of program that you don't want to have a bad program, but you're like, I'm not going to guarantee that our folks are going to get a job. You know, we're going to make sure that they get a degree. And so if you're not willing to dedicate to that simple, do you have a clearly defined competency model? And then do you track that your students, once completing that competency development, place in healthcare leadership and management roles afterwards? If you're not willing to commit to that, then you probably aren't willing to commit to accreditation. And so, again, I'm trying to be honest, but I'm also trying to be fair.
Exactly. Yeah.
Like if you get a Harvard degree, great. If you get a degree from a non-CAHME program, it could be okay. And that's not to say that that's bad education, but that program is not committed to meeting accreditation standards. And that could be for a number of reasons. But what we see is that there are requirements. And if they don't think they can meet the requirements or they don't choose to meet those requirements, it speaks to some potential issue that might not match well with what students are looking for.
Okay. I see it as kind of like a hospital trying to get Joint Commission accreditation, right? That's the hospital that you want to go to,
You're
right?
tracking. No, I
Yeah.
am with you. And
Okay.
it could be that hospital that's not Joint Commission could save your life.
Right.
Exactly. Like they could. I mean, I don't mean to say it's like a coin flip, but
Yeah.
But then it could be that they don't have as many services, or that it takes longer to receive care. I don't know, Michael. I'm trying to be it straight with you, but on the other hand, I don't want to disparage folks that could have their own good reasons for why they don't seek accreditation or not. But I judge that of all the CAHME accredited programs, and I'm a CAHME accreditation official as well, and I just came back last week from a program that those folks, the faculty of those programs are dedicated to providing quality education, and they're all not equivalent, but they all are dedicated to meeting the standards.
Got it. Okay. Again, thank you for answering my questions.
Happy to do so. And I got a soft spot for the Navy. I'm an old Army soldier, but my daughter is she is a sailor. She's in a guided missile destroyer based in Rota, Spain, and so I just had a chance to FaceTime with her yesterday. It was good to see her, and she had her utilities on too.
Yeah, that's awesome.
All right.
Yeah.
Well, thank you for Michael. I'm happy to answer any questions. Is there any other questions, or can I provide any help or assistance for anyone else?
Hi, Mr. Bewley. I was curious, what does the fastest track look like? Is it in-person classes, or would they still be online? You would just be doing the max load?
It would be online. And Erica, if I can, I'm going to show you, I'm going to bring up that slide set to show you what the track would look like. So I'm going to go directly to our schedule. So can you see that slide set?
Just black screen right now.
Oh, okay. Come on.
But I think I took a screenshot.
All right. So I'll just answer your question directly. Look, there are 15 courses in our online MSHA. We offer the courses in a sequenced schedule from fall 1 through the summer. So all of our courses are offered during the year, and the graduate school and the School of Public Health and Information Sciences will allow a student to enroll in our program as many as 13 hours in the initial semester, but a student may request to take an overload to complete the courses sooner. And so our graduate school dean and the dean of School of Public Health have said that if a student enrolls in the initial 13 credit hours, so that would be in fall 1 and fall 2, they would take the 7 hours in fall 1 and then take 2 courses in fall 2. And if they earn a 3.5 or higher GPA in those initial enrollments of 13 hours, then they can apply and have what we call a credit hour enrollment variance. Basically, the graduate school dean and the dean of School of Public Health is saying, we'll allow you to take more than the standard course load, and you can take overload. And so in spring 1 and spring 2, students would take 3 courses in spring 1 and 3 courses in spring 2. So those are 6 courses, 18 hours. And then in the summer, a student would take 6 credits, 2 courses. Now, the current schedule has the MSHA capstone falling in the summer, but for those students that would seek an expedited graduation, then we plan to offer the capstone course in the fall for those students that want to matriculate. And for this group of folks that are on this call, if you plan to matriculate in fall of 2026, then you, by following a student that would want to graduate as quickly as possible from our SHA program, you could complete the 43 credit hours by the fall of 2027. And so that second fall of 2027, you would have 1 course in fall 1, and you would have 2 courses in fall 2. It would most likely be like the project management course and the MSHA capstone. And so a student following that expedited pathway would start in August of 2026 and graduate in December of 2027.
Thank you.
You're welcome. Again, you asked me what time it is, and I tell you how to build a clock, but I do so to thoroughly explain the process, but also to affirm that it is possible to graduate on an expedited basis. But the key aspect is to have demonstrated, good academic performance. Pass your classes. Earn, mostly A's, maybe an occasional B. And what we don't want students to overload with taking 3 courses each of the 8-week terms and then get a bunch of B's or maybe even have a C or 2. We don't want students to simply complete the courses, and pass. We want you to really get the full effect. And so that's why out of an abundance of caution, and aiming to promote, student development, is that if you have the good grades that first fall 1, fall 2, 3.5 or higher, then the deans will allow students to take overload because they've demonstrated that they can handle the full academic coursework. And if you follow that path, you can graduate in just over a year.
Thanks so much.
You're welcome, Erica. Happy to help.
Go Cards.
Go Cards. Keep going. I ran into someone this morning when I was working out that apparently they were Kentucky fans, but they're like, well, you all have to be sure that you beat Duke as well. So I don't have any. I'm 5'9" and I'm good for 5 fouls, but I don't think Coach Kelsey's going to put me in anytime soon. But I'm happy to cheer him on. All right, folks. We're coming up on the top of the hour again. I'm Lee Bewley, lee.bewley@louisville.edu. If I can help provide any assistance, don't hesitate to email me. I'm happy to set up, if you can email a direct question, or if you want to set up a phone call or a Microsoft Teams meeting, or if you're in the Louisville area, if you wanted to come to the office sometime, that's okay as well. I'm always happy to help, talk about career planning in our program. We aim to have a really good experience. We want to carry that Cardinal spirit, both in life and in our careers. So I will close out this session. Thank you for your time. As always, if I can do anything to help or provide any assistance, don't hesitate to let me know. I'm always happy to help. I'll take care. Go Cards.